Hello, my name is Denise Noto, RN BSN. Thank you for watching my reflection video as we kind of reflect on the social emotional intelligence coursework that we have been doing and the table that we made. First off, I'd just like to say some of the skills, the power skills that we were working with. I did notice that I use some of those things already in my practice to make those interactions with colleagues and patients just a little bit smoother, feel just a little bit more positive, and just kind of like work on myself. But it was nice to look at all these elements and see how I can grow, how I can be a little bit more intentional. So the first thing that I talked about in my table was scenarios about self-awareness. I chose growth mindset and gratitude. I try to have a lot of humility. There's a lot of wonderful people that I work with a lot of knowledge. Especially I notice I feel that way in the OR. When we're working as a team, anesthesiology, I've got residents and surgeons, the obstetrician. I've got a PA coming in for the neonate, and I'm sort of Cinderella running around there. I find that if I can be positive, have sort of a lightness or just clarity if something emergent is going on, I can also learn a lot about what's going on in the case, and everybody just starts working together, and I feel like we're all, you just got to be open to growing, open to learning. Also, I do take people aside when I'm struck by something that they did in a situation. Were they an amazing leader? Were they a calm sort of leader of this emergent situation? Were they very patient with one of the moms while she's in labor? Did they deal with an awkward situation very well, or just command a situation well? I try to thank people and just have gratitude for what people do that are part of my team. As far as self-management, stress management, I try to make sure that my room is clean, organized, that I have everything that I need. So when it's time, when it's go time, when it's birthday party time and we're gonna have a baby, I'm ready. And that decreases my stress, and I feel like everyone can do their job a little bit more easily, and then we can have a little bit better experience. Also, if we are in an emergency situation, just kind of like look at all the players and make sure that I'm supplying to them everything that I need, that I'm taking care of the tasks that they're asking me to do, and I'm also delegating to anyone else who's asking if they can help in a certain situation. And when it's crazy busy, maybe there's too many patients, I do one thing for myself, for self-care. I make sure I have food because if I don't have nourishment and hydration, I am not as the same level of nurse that I want to be. I can think, so I'm better even if I just take, small bites or quickly eat something, it's better for me. So I try to do that for myself. As far as interpersonal communication, I chose relationship building and teamwork collaboration. I think this couldn't be more important. There's a lot of personalities, wonderful personalities, sometimes strong personalities, and just making those connections in fun, less stressful times. And then if there is a moment where we disagree or misunderstood each other, or maybe someone was even unprofessional, just taking that person aside and talking to them. How did you think that went? What do you think we could do different? I found that's been really important. And just making sure that sometimes big personalities don't degrade the team. You cannot be micromanaging everybody in the team, supposing that they're not going to do their job. It really degrades the team. That's a big issue for me that I have talked about at my workplace quite a bit with people. And I really think the team is everything. We can really provide better care if everyone's functioning and respecting each other. For executive functioning, I chose critical thinking and curiosity. I love critical thinking. I feel like if I'm solving a problem, I'm, I don't know, I have more passion in my job. There's three central elements of having a baby: passage, passenger, and power. If I can help a woman have a safe vaginal delivery, figure out which way to turn her and what to do for this baby, it makes me happy. I really like it. So I try to always be critically thinking and have a lot of curiosity, ask a lot of questions, try to be learning all the time, from doctors, new procedures, new ways of treatment, new things we're doing, new policies, procedures. I try to always stay in touch with that. And social awareness, I chose cultural awareness and appreciation for diversity. I was able to work and live in Miami for 10 years. And also, I did live in Mexico for a year. I think speaking Spanish, it just helps me be a little bit more in touch with that Latin population. They do become my patients a lot because I speak Spanish. And just helping other nurses that are maybe having a confusion with a patient, or they're just not getting something, or they're upset, helping them understand, where is that person coming from? What don't they understand? Why are they afraid? So just talking with people and helping them understand those unique cultural differences. And I think that can be very rewarding as well. Thank you for watching my video, and good luck with the rest of the course.